Gut Microbiome and Cancer by Konashuk and Jacqueline Kirby.
So what is the gut microbiome? Basically, the gut microbiome consists of a collection of bacteria, fungi, and other microbes, and they live mainly in the large intestine. The gut microbiome controls digestion, obviously. It also aids in immune system, and it supports overall health. It's no secret that a healthy gut leads to a healthy person.
So the gut microbiome research has been around for decades. However, in the field of cancer research, it's been a lot later. One of the studies that kind of kicked off research for the gut microbiome in regards to cancer was a study done by Bertrand Rudy, a doctoral student at the Gustave Roussy Cancer Center.
Yeah, so like Jacqueline said, the key article by Rudy was done by the doctoral student, and he had actually published evidence that the gut bacteria seems to boost people's response to cancer treatments, and this was led by the major growth in the new drug called cancer immunotherapies, which caused scientists to take a closer look into how the gut microbiome actually interacts with these drugs and how that can harness treatment. So they did experiments that tested on mice, and it revealed that the bacteria in the gut can actually alter the response of these drugs. So that sparked new clinical trials that are being done to see if the gut microbiome can actually be manipulated to alter the cancer drugs response in order to benefit for the patient.
So with all this new research, they were eager to get into clinical trials. Lots of scientists were quite excited for this, to see how the gut microbiome could increase the effectiveness of treatment. So they wanted to understand how it worked better, since not a lot was known about the exact mechanism, which meant clinical trials need to be put in place. However, some were concerned that clinical trials were too soon because there is quite a risk with gut microbiome research. One such individual that raised concern was William Hanage, an epidemiologist at Harvard T.H. Chan School of Public Health.
Yeah, so like Jacqueline said, there was negative results, and although this research was very new, the relationship between the microbiome and cancer has been actually studied for many years, and that began with linking the gut bacterial Helicobacter pylori, which was the cause of gastric cancer. It caused an inflammatory response which harms the mucus layer that protects the body from outside threat, and this inflammation causes a new location that's ideal for tumor growth. So they did actually know that there was a connection between the two, they just didn't know what that was yet. And then in other cases, they actually found that the bacteria become resistant to the anti-cancer drugs, and this obviously promotes the cancer cells.
So Lawrence Vogel was a big researcher for this field as well. Her study in 2013 found a link between a chemotherapy drug which damages the mucus layer of the intestine, and this allows the gut bacteria to go into like the spleen and the lymph. And then her study in 2015 confirmed that certain gut bacteria increase their response in checkpoint inhibitors. Her studies in 2013 and 15 confirmed positive links between the gut microbiome and immune system, and this encouraged other researchers to do more studies to understand the mechanisms better. So she really inspired more research in this field.
Checkpoint inhibitors are immunotherapy drugs that are antibodies to surface-to-cell molecules such as CTLA4 and PD-1. And how these antibodies work, at least for CTLA4, it works by boosting the number of helper T cells in the immune system, and PD-1 works by blocking the molecule that shields the cancer cells from attack. And so at this point, they knew that there was a chemical stimuli between the microbes in the gut that respond to the immune cells that provide a better attack. The only problem was that only a small fraction of people responded to this kind of treatment.
Okay, so a therapeutic application would be a fecal transplant. So in order to increase the number of people who respond to treatment, certain beneficial bacteria are transferred into the intestine of people who weren't responding to treatment by a process known as fecal transplant. This significantly improved the responses. These transplants work by introducing new microbiomes, which eventually reshape the gut microbiome of the non-responder in a way that is beneficial. So this is already a mainstream treatment for non-cancer diseases.
These transplants do have issues, however. Just as the good bacteria can be transferred to a patient, so can the pathogenic ones, and they definitely found this. So in order for this treatment to be successful, the researchers have to be extremely careful in selecting donors and screening for the pathogenic microbes. So this is why, in addition to the transplants, they actually made a pill containing spore-forming bacteria that can directly be given to patients to decrease the risks of introducing those pathogenic microbes. And then it also offers a bit of a more convenient treatment option as well.
How does the gut microbiome work with immunotherapy? The short answer is we don't know yet. So this is a huge point of research in the field, and the current hypothesis about this is that it gives a person's immune system a boost to respond against tumors and how easy it is to do so. Bacteria in the gut provide a chemical signal that stimulates the immune cells. So the exact mechanism is still unknown, and that's what all this research is needed for.
So the issues and concerns. When they started doing this, many of the studies that they did either proved to work, not work, or be a lot more complicated than they had first anticipated. So they did encounter some unexpected side effects such as weight gain and obesity. It's still very new, but they did find that the results are definitely promising. And they're also starting to standardize the approach, screening a little bit better and starting to understand a little bit more in the field to make it a bit more available.
So what's the end goal? So the goal is to use the gut microbiome as a biomarker to indicate to doctors and researchers which treatments will work best for which patients.
So in summary, new trials are being conducted, and although some feel it's too early, if the gut microbiome can actually be manipulated in order to provide a cancer therapy, they feel that it's definitely they are able to continue on with this research, even though it could be too early. They also found that it works with non-cancer treatments too. They found that it works for conditions such as Crohn's and ulcerative colitis, so they're taking a step in that direction as well.
So our further research question is, what is a biomarker? Would the gut microbiome be diagnostic, prognostic, and or therapeutic biomarker? So biomarkers are a medical sign that indicate a patient's medical state, such as disease, infection, or an environmental exposure. They are simply characteristics you can measure accurately. So blood pressure is an example of a biomarker. A diagnostic biomarker will tell you if you have a disease. Prognostic biomarkers tell the severity of the disease, and therapeutic biomarkers predict what therapies will be used most effectively. So the gut microbiome would be considered a therapeutic biomarker. and this is our list of references.